Welcome aboard, everybody. Dr. Peter Glidden here, your steadfast advocate for health, welcoming you to another live edition of Fire Your MD Now, my absolute favorite radio program in the world. And I hope that it's yours, too, because what we talk about here every day is information which is literally, not figuratively, literally life-saving. Perspective that we bring to bear on the way that medicine is delivered, the way that medicine is designed, the way that medical data are interpreted through the reductionistic lens, which is an old-fashioned, outdated, anachronistic, Machiavellian, mediocre, dangerous way, and the more contemporary, holistic way, which is, the undiscovered country. Very few physicians in the world are actually schooled in and have any clinical experience with the practice of holistic medicine. And this is a very important distinction because, just like in politics, there are different philosophical ideologies. Well, there are different philosophical ideologies in medicine, and most people find that hard to believe, but it is in fact the case. I mean, the most telling example of this historically is Galileo. Galileo being thrown in jail because he was brash enough to assert that the Earth goes around the sun, that the sun is at the center of the solar system, that the Earth is not at the center of everything, that it's a heliocentric universe with the sun at the center, not an Earth-centric solar system. This was a great big blow to conventional scientific wisdom, scientific wisdom, scientific wisdom. After that, of course, it was, the Earth is round. Oh, that was a big controversy. Of course the Earth isn't round. The Earth is flat. How could it possibly be round? Things would fall off, right? So inside the world of science, there are philosophies which are correct or incorrect, or which are jaded or biased a priori or not. And the medical model espoused by your MD is reductionistic medicine. It's not medicine, it's reductionistic medicine. There's no physician in the world that practices medicine. That's like saying there's a preacher in the world that practices religion. Well, no, there's not. There's a Baptist, there's a born-again Christian, there's a Muslim, there's a Hindu, there's a Buddhist, there's a Mormon, there's a Roman Catholic, right, et cetera, et cetera, et cetera. There are different types of religion. There's no one pastor in the entire world that practices all religions. It doesn't exist. Nor does it exist in the world of science. Your medical doctor doesn't practice medicine. They practice reductionistic medicine. Your research money, your amyotrophic lateral research money, your cancer research donations, your heart disease research money, your muscular dystrophy, cystic fibrosis money don't go to medical research. They go to allopathic reductionistic medical research. And allopathic reductionistic medical research has yielded hardly any results, poor to none results when it comes to coming up with a cure for chronic disease. Again, we've taken the wrong dog to the hunt. We've taken the wrong, given the money to the wrong philosophical branch of science. The branch of science that the MDs are best suited to interface with and to deal with is surgery and trauma cure when it's absolutely necessary. I mean, it doesn't get any more reductionistic than, a bullet in your arm, heaven forbid. That's as reductionistic as it gets. And that's what the MDs are best at. The stuff that they can do in the surgical arena is just this side of miraculous. And, as I am wont to say, whenever you have a hammer, or if all you have is a hammer, everything looks like a nail. So the orthopedic surgeon is going to tell you you need the hip replacement, even though, in point of fact, you probably don't. The orthopedic surgeon is going to tell you that you need the knee replaced, when, in point of fact, you probably don't. Because, they only know what they know, and when they surround themselves with other colleagues who practice the same thing, it becomes reality by consensus. And they'll tell you, oh, no, you have bone-on-bone arthritis, you can't possibly regrow cartilage, and oh, no, that's, all you need is the knee replacement. And then you say, well, okay, doc, I'm going to get a second opinion, and you do a medical nutrition intervention and you grow the cartilage back and you recover from the arthritic condition, then you go back to the orthopedic doctor and they don't want to know what it is that you did to fix it. They don't. Because it is not in their wheelhouse. And they're not going to step outside of their wheelhouse, because if they step outside of their wheelhouse, they're not going to get paid, or they're going to get sued because it's not in their scope of practice. And so insanity begets insanity, and the world collapses underneath the weight of ineffective, monopolistic, Machiavellian, mediocre medicine, which is what the MDs bring to bear in the treatment of chronic disease. You don't believe me? Well, you should. Facts are a stubborn thing. You're welcome to your own opinion, but not your own set of facts. While we've given our control, the control of medicine, to the MDs and the pharmaceutical and the insurance companies and the hospital industry, type 2 diabetes is skyrocketing. Obesity is skyrocketing. Alzheimer's has risen from obscurity to become the 6th leading cause of death. It's skyrocketing. Cancer, not a cure in sight. Amyotrophic lateral sclerosis, forget about it. Chronic diseases are getting worse. Life expectancy is getting shorter. We're going straight to hell in a handbasket, and it's for one reason and one reason only. We've taken the wrong dog to the hunt. We've given all of the money and all of the power and all of the control to the allopathic, reductionistically trained physician, and they've dropped the ball, and they've dropped the ball big time. But over the last 100 years, they have convinced us through, a psychological warfare campaign that the only real medicine is MD medicine and every other type of medicine is alternative quackery, right? You've been convinced that I practice alternative medicine. Well, I don't. I practice naturopathic medicine. Calling what I do alternative is like calling, a poodle an alternative dog. Now, the only real dog is a Great Dane. Those German Shepherds, those Golden Retrievers, they're alternative dogs. That's what it's come to in medicine. We are alternative to mainstream medicine, but mainstream medicine is mainstream not because it's better, not because it's more scientific, not because it's more effective, but because the MDs, the American Medical Association, the pharmaceutical industries have legislated themselves into the first place, and they stay there aggressively. Again, we do not have a free medical market. And if we did have a free medical market, within 5 years, the MDs practicing general family practice would be out of a job. They would be out of a job. Dr. Wallach gives a lecture about a month ago in Los Angeles. A couple of hundred people have registered to come. 1,200 show up. The fire marshal comes. They need to stop the lecture while they move, speakers to the lawn out in front of the pavilion that the event is taking place inside, because there's 1,200 people and the event can only seat 350. So why did so many people show up? Because over 400 people in a suburb of Los Angeles completely reversed their type 2 diabetes with medical nutrition. And they told everybody in their life about it. And that word spreads like wildfire. But again, the MDs don't care. They don't want to know. They don't care about it. And you should be extremely concerned about this. Because in point of fact, the startling fact of the matter is, again, your medical doctor may be the nicest person God ever created, but they don't know what's best for you. They only know what they've been trained in. And in a perfect world, it would be illegal for them to give you advice about other types of medicine that they have no idea about. So rather than the orthopedic surgeon saying, well, I don't have any experience with medical nutrition, perhaps you should give that a try, because I've had a number of patients who actually have recovered with medical nutrition and didn't need surgery. And here's the name of a doctor I'd like to refer you to. That's what they should do, but that's not what they do. What they do is, give it to you from their perspective, which I guess would hold up in court. Because if I didn't have any experience with Buddhism, or if I didn't have any experience with, born-again Christianity, I could say, well, that born-again Christianity stuff doesn't work. Because I don't have any experience with it. The MDs say that all the time, and we give them a pass. We need to stop giving them a pass. We really do need to stop giving them a pass. In my book, The MD Emperor Has No Clothes, which, by the way, you can get for free now, go to freedoctorbook.com, freedoctorbook.com, freedoctorbook.com. You can download my book for free. Is free good? Free's pretty good. If you don't want an electric version, you can get the old-fashioned softback. Go to drglidden.com, click on the store button. In my chapter on cancer, I have 10 questions that every cancer patient should ask their oncologist. I was thinking about this the other day. Actually, it's 10 questions that every patient should ask their physician if they're saddled with a chronic disease. Yeah, doctor, I've got type 2 diabetes, and I see that you're recommending metformin and glyburide, and I just have a few questions for you. Number one, does this treatment cure the type 2 diabetes? Does it cure it? Well, if it doesn't cure it, what can I expect from it? What are the side effects of the medication? What are you going to do to handle the side effects of the medication? How much is this all going to cost me? What percentage of revenue do you make from treating my diabetes rather than curing it? And why isn't there research being done in a cure? Because I read all the time about nutritional strategies which are extremely effective in supporting and promoting the structure and function of my body's ability to metabolize blood sugar. So why don't you know about that? And how much money is the hospital going to make from managing my diabetes for 40 years? And how much money are you going to make from managing my diabetes for 4 years? And I'd like the name of 10 of your patients, my age, my sex, my demographic, who've had the same diagnosis I have when they've been patients of yours for 5 or 6 years. I want to talk to them to see how they're doing. Now, if every patient in the United States had a similar conversation with their MD when it came to the treatments that the MDs proffer up for chronic disease, very few people would undertake the madness. Because it is madness. It is Machiavellian, monopolistic, mediocre medicine brought to you by intellectual cowards who are unwilling to look outside of their box of unbelievable ineffectiveness. Fire your medical doctor, ladies and gentlemen. Get a clue, get your health back. Tune in and turn on. We're back after these messages. Welcome back, ladies and gentlemen. Dr. Peter Glidden here, your steadfast advocate for health. Welcome to another live edition of Fire Your MD. And this is the deal, right? Because we don't know what we don't know, and most people, having no experience with, the ins and outs of science as it's practiced here, not just in the U.S., by the way, this is a worldwide phenomenon, just assume that their medical doctors are the best and brightest minds in science, and they're not. Might be the best and brightest minds in reductionism, and they might be the best and brightest minds in figuring out, robot surgeon stuff, but they're horrible. They are the wrong dog for the hunt when it comes to chronic diseases. They are 100% incorrect most of the time. Then the other percentage of the time, to 5, 6, 7, 8, 9% of the time, they're 90% incorrect. They're not 100% incorrect. They get it a little bit right, but they've completely thrown the baby out with the bathwater. Right? They'll tell you heartburn is caused by too much stomach acid. It's not. It's caused by not enough stomach acid. They won't be able to tell you the mechanism that causes heartburn because it doesn't exist. They'll tell you that your body has developed autoantibodies against self-tissue. They'll tell you that your body has developed antibodies against the thyroid, antibodies against the joint, and they won't tell you how. They won't even proffer an explanation except to use the old worn-out scapegoat. Oh, it's all genetics. And then when we hear the word genetics, we shrink in humility before the great intellect before us. I just did an entire webinar that blew the lid off of this whole concept of gene-generated diseases. It's called epigenetics. It's in the archives. Become an insider. Go to drglidden.com. Become an insider. $20 a month for a subscription to a couple of 100 hours of health webinars. One of which, the latest of which, is on epigenetics. You need to know these things, folks, and you need to know it before you get sick, because there's a lot you can do with prevention. And also, when you're sick, you're scared and you're up against it. And you're going to do something. And, most people are just going to follow the herd, and they're going to go to conventional medicine because that's the only really option that you have. And the conventional medical doctors are the wrong people to go to for a chronic disease. You need to know beforehand what to do. You need to know beforehand how to support and promote your body's ability to optimize its structure and function. You need to know beforehand which foods to not eat. You need to know beforehand which nutritional supplements to take, how to take them, when to take them. You need to know these things. I mean, you figured out how to drive your car safely, right? That's a good thing to do because it helps you in your life. You figured out how to do rudimentary mathematics. It's a good thing to know. It helped you in your life. You figured out that you shouldn't pee upstream and drink downstream, right? That was a rudimentary skill. It helped you in your life. You put clothes on when you go outside, right? That helps you in your life. It protects you from the stress of the environment. You learned how to eat food regularly, right? Learned how to pay attention to your psychological state, right? There are life skills that we learn as we go down the track to make life easier. Well, there's a big skill set you were not taught and that you do not know. A gigantic skill set. A big piece of the pie of survival, Earth Survival 101 that you were not taught. It is impossible to secure all of the nutrients that your body needs in order to function properly from food. You cannot do it. It is impossible. You must supplement. And if you don't supplement, it's only a matter of time until your body reaches a point of nutrient deficiency and then something breaks and then you go to a medical doctor and they throw a drug at it and it doesn't fix it, it manages it. It gets worse and worse and worse and worse and worse and then you die. But before you die, you suffer. And it all could have been prevented with just a little bit of knowledge, just a little bit, not a lot. I'm not saying you don't have to go back to school. You don't have to get a medical degree. You don't even have to be smart enough to know how to spell vitamin. If you're smart enough to pass the driver's license test, then you're smart enough to know how to take care of yourself with new fashion, science-based, clinically verified, tip of the spear, holistic medical nutrition. And as God is my witness, the single best place to start in that inquiry is Youngevity. Youngevity brings to the table the most effective nutritional supplement strategies I've ever seen. I've been doing this for 25 years. This is why I'm such a gigantic Youngevity cheerleader, because it is extremely effective in its effectiveness. That from the Department of Redundancy Department. Stick around. We're going to the phones when we come back. It looks like Robert in LA is up first. Thanks for tuning in. Welcome back, everybody. I'm Dr. Peter Glidden, your steadfast advocate for health. Let's get right to the phones. They are ringing off the hook. Robert in LA is up first. Hey, Robert, thanks for the call. You are live.
Hi, Dr. Glidden.
What's going on, Robert?
I wanted to ask you about a friend of a friend who's 32 years old, is 5 feet 2 inches, 165 pounds. She's 16 to 17 weeks pregnant. Has been told that the baby might have Down syndrome.
Yeah.
By other naturopaths, has been told that her body is kind of cold. I don't know if that makes sense. But primarily, the doctors tell her that she's low on the protein that gives oxygen to nurture the baby through the placenta. And so they also tested the baby's beats per minute, and it's 150. And they want to see if they can take blood out of the, pretty much, the baby, the fetus, I guess.
Well, stupid is as stupid does, and really all that the MDs have here is some type of heroic intervention. They see the body like a machine, like we're all robots, and, we just got to take a part out of here and give it over here, and they have no earthly understanding of the real motive driving forces here that are causing the facultative breakdown of all the bodily tissue and causing the trouble. From our point of view, Down syndrome is a deficiency in zinc. It's a deficiency in zinc. And it's interesting that you should talk about this now, because the webinar that I did last Thursday night alluded to this specifically, the relationship between a zinc deficiency and Down syndrome. And I explained how that happens on the webinar. So I would encourage this woman to become an insider and watch the webinar that I did on epigenetics. It's brand new. It's hot off the press, and it's been in the archives for not even 7 days now. So we have a interesting historical anecdote. I don't know if you ever remember the stunt car driver. He wasn't really a stunt car driver. Evel Knievel, right? He'd jump motorcycles over enormous distances. Well, I believe it was his daughter-in-law, or maybe his daughter, I can't remember. She had the same situation. She, in her first trimester of pregnancy, she was pregnant, and her baby was diagnosed through amniocentesis with Down syndrome. And they got on board with Dr. Wallach's medical nutrition support program. And when the child was born, because they didn't want to have an abortion, it just wasn't their thing. The child wasn't Down syndrome. He was a normal, healthy child. So from our point of view, the body needs nutrition all of the time, and especially when it is developing in utero. In a perfect world, women would be nutrified with the 90 essential nutrients for 6 months before they even thought about getting pregnant, and they would have eliminated the 10 bad foods as well, so their body's stores can be filled right to the brim. And then throughout pregnancy, they'd be taking the 90 essential nutrients in order to just feed the baby, because the baby's body is growing too. You know, we can't go back in time, but the intervention here, if this were my relative, is I would put her on the 90 essential nutrients. So here's what I would put her on immediately as an immediate intervention. And if this was an effective intervention, it should produce noticeable results within 3-4 weeks, right? There should be a noticeable change in whatever the negative stuff that's going on right now. And remember, all birth defects happen in the first 90 days of pregnancy. All birth defects happen in the first 90 days. So we need to intervene quickly here. The recommendation would be eliminate the 10 bad foods, 1 Healthy Body Start Pack 2.0 liquid, 1 Healthy Body Start Pack 2.0 liquid, 2 bottles of selenium, 2 bottles of plant-derived minerals, and 1 bottle of de-stress per 100 pounds of body weight per month. 1 bottle of de-stress, 2 bottles of plant-derived minerals, 2 bottles of selenium, and 1 Healthy Body Start Pack 2.0 per 100 pounds of body weight per month. That's what I would do if I were her. I'd keep my fingers crossed, and I would see what would happen. The reproductive tract of the human body is extremely forgiving. The child needs nutrition. The mother's body needs nutrition. It is never too late to intervene. I mean, what do they have to lose, quite frankly? I would go for it if I were them. Thanks for the call, Robert. Alabama is up next. Cheryl, talking about an allergic condition here. This should be an interesting conversation. Hey, Cheryl, thanks for the call. You are live.
Hi. I really don't believe it's an allergy, but that's what my client/sister is suspecting, because I had to take her off the first calcium and put her on the Cal-Toddy, and she's had the same issues with the diarrhea/constipation on and off.
Okay, so something is happening, right? But it's not an allergy, because you can only be allergic to a protein. I mean, and a calcium is an essential nutrient. You cannot be allergic to an essential nutrient. You just can't. That's like saying,
okay,
well, I'm allergic to water. So something is going on here, but it's not an allergy. Okay? You're with me?
Okay, she's reading that is a possibility, that there's all sorts of people out there who have allergies to calcium.
She's wrong. So it's impossible to have, you can only be allergic to a protein. You know, I mean, this is one of the problems with the internet, that there's stupid information put up by stupid people, read by people who didn't, she probably didn't even have a biology class in high school. And she's listening to what these people have to say rather than listening to the medical professionals who are trained in this. So, she can navigate her life by her own compass and reap the benefits thereof, but this is not an allergic reaction. If she's having a reaction here, the problem is with absorption. And the problem with absorption speaks to a small intestine that's been compromised by decades of eating wheat, barley, rye, and oats. The small intestine is the organ in the human body that absorbs nutrients, and if the small intestine has been compromised, it can't absorb the nutrients efficiently. So she'll take the calcium, she'll absorb a little bit of it, but the lion's share will pass into her large intestine where it creates trouble. There shouldn't be calcium in the large intestine. There shouldn't be any of the stuff that's in those supplements in the large intestine. It should all have been absorbed into the bloodstream. When it makes its way into the large intestine, because the small intestine has been screwed up, that's when it causes trouble. So this is a diagnostic indication that she has trouble absorbing nutrients, and that is all of the time caused by wheat, barley, rye, and oats. So the recommendation here is to eliminate the 10 bad foods and to take the liquid calcium and the other nutritional supplements in a more dilute fashion, extended out over time. Watch the webinar that I did on my Insider membership called Maximizing the Absorption of Your Nutrients. It's a telling webinar. It might help to bring her into the light, but you never know. You can't fix stupid, like the fella said. Let's go to California and talk to Dora. Hey, Dora. Thanks for the call.
Hi, Doctor.
What's up, Dora?
Well, I had something odd. My left arm between my elbow and my wrist, it feels like something's crawling on my skin, kind of creepy-like.
Yeah. Do you live with a Republican? Because that's probably it.
No, I don't. I live alone.
Okay. So the recommendation, so creepy crawly things in the skin, that's an interesting thing to happen.
Yeah.
That speaks to not enough essential fatty acids, because the skin, if you were to look at the skin in a cross section, like you cut a tree in half and you look at the rings on it. Well, if you were to do that to the skin, there are a number of different layers to the skin, and they're all kind of glued together, so to speak. They're all attached. And if the skin loses essential fatty acids, the layers between where the attachments of the different levels of the skin are can start to become kind of unlubricated and create friction just from moving around, and that causes an itchy, tingly sensation.
So I take EFAs, but maybe not enough.
Well, that would be correct. And also, if you don't have a gallbladder, that would be a problem. Do you still have your gallbladder?
Yeah, I have everything.
Okay, yeah, thank God. So how much do you weigh, and how many EFAs do you
That's
take?
the trouble. My arms are really thin, and my veins stick out too. So I don't know if that's
No, that's got
problem.
nothing to do with it. So, you mean your skin is thin, or your arms themselves are thin?
Well, my body and arms are thin.
Okay, so how much do you weigh?
Oh, about 116.
116, and how many EFAs do you take a day?
I take about 4.
Okay, so here's what I'd like you to do as an experiment for 7 days in a row. I want you to take 9, 3, 3, and 3 of the EFAs. 3, 3, and 3. Take them with a meal. Take them with a meal.
Okay.
How much water do you drink?
I'm trying to drink a lot of water. Lately, I've been putting a jug on the sink that tells me to drink it all during the day.
Yeah, okay.
About 6 glasses.
All right, that's good enough. And put a little lemon juice. You know what you also can do is put a little lemon juice in about an ounce of warm water. Squeeze half of a lemon into an ounce of warm water and drink that down about 15 minutes before you have a big meal.
Yeah. And then a while back I called, I seem to be like a nuisance. I called back about selenium for varicose veins.
Yeah.
And then do the veins eventually go away, because I've had them for so many years?
Well, it's hard to know, right? I mean, I've seen varicose veins recede. I've never seen them disappear. That doesn't mean that can't happen. But generally speaking, the problem with varicose veins is that it's like the check engine light on the dashboard. It's an indication that the game is afoot. And the way that it goes in the human body is those are driven by copper deficiencies, right? So when you have, this much of a copper deficiency, you'll get hemorrhoids or varicose veins or spider veins, and then you'll get, gray hair or white hair. And then the larger arteries inside your body, like the carotid arteries or the big aorta coming off of the heart, their health will start to become compromised. And then you are a candidate for an aneurysm And that's a big bad voodoo daddy. So whether or not the varicosities recede, if you are supplementing with the selenium that has sufficient levels of copper in it, then you will go a long way towards making your veins and your arteries healthy, so that that big bad voodoo daddy stuff isn't going to kill you, 10 years from now.
Well, I'm taking the selenium. You told me to take it like five a day.
Yeah.
Yeah, keep taking them, right?
Oh, yeah, I take 12 a day. I take 12 a day. I'm 200 pounds. I take 12 a day.
And you don't have varicose veins.
No, and God willing, and the creek don't rise, that ship is not going to sail either. So
in my weight, 5 is not too many a day.
No, you can tell. I've seen there's a handful of people that have a reaction to selenium, and which means they're taking too much, and it really is independent of their body weight. Nobody really knows. But if you or anybody else takes too much selenium, you'll get garlicky or fishy breath. You'll get brittle nails or brittle hair.
Oh,
if any of those things
really
start to happen, you just back off by selenium by 2 or 3 capsules a day, and you should be good. But those are telltale symptoms that your body has taken too much.
Yeah.
Give that a try, Dora, and let me know what happens. Ladies and gentlemen, much more to come. I am Dr. Glidden, and this is Fire Your MD Now. Marie in Arizona is up next. Hey, Marie, thanks for the call. How hot is it in Arizona today?
It's quite cool. It's only 85.
I was in Arizona in August, and man, oh man, that was hot with a capital H. It wasn't hell, but you could see hell from my hotel room. That's how hot it was. I don't know how you guys deal with it in the summer. Of course, I guess most people don't know how we deal with the cold in the winter. So I guess that sword cuts both ways, right?
Yeah.
So hey, Marie, enough of this small talk. Thanks for the call. What's up?
Well, my husband's been on the protocol for about 10 months. He's got acid reflux disease. Yeah. He's got a non-functioning valve at the esophagus, and acid, sloshes up. He's had reduced gas, but he's still burping up, acid into his esophagus. And
all right. Is he getting any traction at all from the program? Has anything dramatically improved in 10 months?
Well, he stopped farting like crazy.
What about mood, energy, sleep, aches and pains, arthritis, blood pressure, anything?
Generally, his health has improved, yes.
But he's still stuck with the digestive issues vis-a-vis heartburn and stuff like that, right?
Yes.
Okay, now, if before he started the program, on a scale of 1 to 10, the heartburn was a 10, what is it now?
Probably an 8.
Okay, so there's been a little bit of improvement. That's good. So how much does he weigh?
About 190 pounds.
Okay. And so here's what I would like him to take for 2 weeks as an experiment to see if it makes things better. Okay?
Okay.
2 weeks. We're looking for a dramatic improvement in 2 weeks. All right. So has he gone gluten-free? Has he stopped eating the 10 bad foods?
Yes, absolutely.
Excellent. Is he salting his food so that it tastes good?
Yes, plenty of salt.
Excellent. Okay, great. So here's what I would like him to do every day for the next 14 days. Please, I'd like him to do 1 ounce of the liquid calcium, not the powdered calcium.
That's
1 ounce of the liquid calcium in 1 ounce of orange juice 4 times a day. And I want the last dose to be before bed, immediately before bed. 1 ounce of the liquid calcium in 1 ounce of orange juice 4 times a day. Okay?
Mm-hmm.
I want him to take 2 digestive enzymes at the beginning of every meal. I don't care if it's breakfast, lunch, or dinner. I don't care if he eats a cracker. I want him to take 2 of the digestive enzymes at the very beginning of every time he eats. 2 of those. Okay?
Okay.
I'd like him to do 1 scoop of the Beyond Tangy Tangerine in 12 ounces of water. 1 scoop of the Beyond Tangy Tangerine in 12 ounces of water 4 times a day. 4 times a day. And I want him to take at least an hour to drink each dose down. 1 ounce. 1 level scoop of the Beyond Tangy Tangerine in 12 ounces of water 4 times a day. And lastly, 2 EFAs with breakfast, 2 EFAs with lunch, and 2 EFAs with dinner. Now, I want you to go to the health food store and get a little bottle of extract of peppermint oil. And every time he starts burping and belching, I want you to put 2 or 3 drops of peppermint oil in about an ounce of warm water, a little bit of warm water, and have him swallow it down every single time he starts burping and belching, and see whether or not this combination of things makes traction with the heartburn. Call me back in 14 days after he's done it. We'll talk about his experience, and I'll tell you what to do next. And I appreciate your trust. Go for it. 14 days. I'll be looking for the call back, and we'll see what we can see. Hour 2 coming up, ladies and gentlemen. Where does the time go? Again, please join the live video stream and the live chat, the drgliddenshow.tv. Hey, everybody, welcome aboard. Welcome back. It's the second hour of Fire Your MD Now. So much to know, so much to understand, so much to, embrace and expand the consciousness with. And this is really what we're up to here, giving information for free to anybody who has the ears to hear. And quite frankly, everybody needs to know what we know, so we encourage you to become a member of Youngevity and join our grassroots coalition of the informed. Help us to spread our message of foundation medical nutrition for the masses, to the masses, because everybody needs this stuff. Everybody feels better with this stuff. This stuff is essential, no pun intended. And when people, don't know what they're missing, and their medical doctor is clueless about any of this, because their MDs have no training, no experience, no respect, and no appreciation for medical nutrition. And so the MD is completely unable to help people with medical nutrition, and yet they give people advice all the time. Oh, no, don't take that selenium, it's dangerous. Even though selenium was proven to be an essential nutrient in the 1950s. It was proven to be an essential nutrient in the 1950s. There is so much information about the positive effects of selenium on human health that the founder of Youngevity, Dr. Wallach, was able to secure for Youngevity a qualified health claim from the Food and Drug Administration regarding selenium. And in order to get a qualified health claim from the Food and Drug Administration, you literally have to bring truckloads of published research regarding what you're talking about, in this case, the positive effects of selenium on human health, and give it to the Food and Drug Administration. So because of Dr. Wallach's research, we can legally say that selenium supplementation reduces breast cancer occurrence by 82%. Prostate cancer by 64%, I believe, colon cancer by 69% maybe, and lung cancer by 39% even if you are a smoker. Selenium. If a medical professional tells you that selenium is dangerous, that's like a medical professional telling you that sunlight is dangerous, that oxygen is dangerous, that calcium is dangerous. Oh, wait, they already do that. I must be wrong. Let's go back to the phones and get some questions answered. Wendy from Iowa is up. Hey, Wendy, thanks for the call. You are live.
Hi, Dr. Glidden. I wanted to do a little bit of tweaking for a colleague who's 51 years old. He has a history of bladder infections and now has bladder cancer. He's been doing much better. You've had him doing the anti-aging pack for selenium, some Z-radical. What I want to run by you is when he walks a lot or exerts himself, when he lifts anything heavy, he gets in a lot more pain and he has a lot more blood clots. Now, when he took glucogel for his knee, it seemed there was a bit of a pattern there that he would get better. And does that make any sense to you with bladder cancer? Or is it just our imagination that the glucogel was helping?
What do you mean he would get better in what regard?
Any pain he had, and also blood clots. It seemed to improve when he was taking the glucogel, which was for his knee, but it just seemed that his other symptoms were getting better.
Well, I mean, that's interesting. Everything's connected. I've never heard of that before, but if that was his experience, then we need to lean heavily on that. So I would say, look, go back to the glucogel.
Okay.
Was it the glucogel caps, or was it the glucogel caps or the glucogel liquid?
It was the capsule.
All right, so go back to the caps. Now, the other thing not to overlook here is the research clearly shows with bladder cancer specifically, remember, we don't treat bladder cancer, we don't treat cancer, we don't treat anything on this radio show. We support and promote the body's ability to optimize its structure and function regardless of the disease process. So, however, the research clearly shows that supplementation with probiotics greatly reduces the return of bladder cancer once it's been eliminated through some type of means. So Flora FX, Nightly Essence, Root Beer Belly from Youngevity.
Okay.
Quite frankly, any type of probiotic that you can get your hands on that's of good quality is the way to go. I would lean on Root Beer Belly first. Well, you know what? Because of the blood clot issue, I would do Nightly Essence. Because the Nightly Essence, in addition to the probiotics, also has a biochemical in it called nattokinase, Nattokinase, which has been documented to dissolve blood clots.
Oh, okay.
So I would give him the Nightly Essence moving forward. I'd give him 3 before bed and 3 in the morning. Also, essential fatty acids have been proven to virtually eliminate the risk of thrombotic stroke. And they do that by normalizing the viscosity of blood. Again, this is another qualified health claim that Youngevity was able to secure because there are mountains of published research papers that support this. So I would max out on essential fatty acids. I take like 15 to 21 essential fatty acids a day.
Okay.
And, our take on supporting the immune system, right, with people that have a diagnosis of cancer is 100,000 ORAC points of antioxidants a day, however you can get it. 100,000 ORAC of antioxidants a day would be very, very, very important. And, of course, we don't overlook the obvious. Eliminate the 10 bad foods.
Right. So in the foods that are the good foods, what should be the ratio of protein and greens and eggs? Is there more of one of those he should be eating?
Nope, I don't really care as long as he's eliminating the 10 bad foods. Just have him follow his appetite and see what happens. Immune health is made from protein. Your immune system is made from protein, but too much protein in the diet will make the blood acidic, and that's a problem. So really, my experience with dietary disciplines is that once you've eliminated the 10 bad foods and your body's nutrified, then your appetite kicks in and your body will tell you what it needs.
Okay.
So I'm not going to get bogged down in those details. If you want to get bogged down in any details, make it be 100,000 ORAC of antioxidants a day, 100,000 ORAC of antioxidants a day. Acidophilus, 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 more EFAs. Keep your fingers crossed and stay in touch. Thanks, Wendy. I appreciate you very much. California. Next, California, the ex-gubernator of California is going to talk to us. Arnold Schwarzenegger. Oh, no, it's Brian instead. Hey, Brian, thanks for the call. For a minute there, I thought you were Arnold Schwarzenegger. What's up?
Yeah, I've got a friend that I've known for 40 years, and he's got prostate cancer, and I didn't find out about it until he'd already elected to have radiation pellets implanted in his prostate. And I'm wondering if he can, through Youngevity, fortify his system and regain his health from the prostate cancer.
Well, we don't treat cancer and nobody knows. And in a perfect world, we would have answered this question years ago because conventional medical doctors are not successful in treating cancer. They're not. They are not successful in treating cancer. They are not. If you look at the statistics for cancer rates of survival, they're nil. They're bad. I mean, their generation of cancer treatments doesn't work. It doesn't work. That, at best it prolongs life a couple of years and adds into the bargain lots of suffering and personality change and energy change, and your teeth fall out and your hair fall out. Oh, but you got 2 extra years of life. Well, thanks a lot, Doc. So they've completely dropped the ball, but because they monopolize the industry, nobody else is able to give it a shot, right? So that's why there are no alternative cancer treatment centers in America. There aren't, because it's illegal. So, right? I mean, in a perfect world, man, what my colleagues would have been doing cancer research for 100 years, but we haven't, because the MDs have, bullied us out. And, the pharmaceutical industry holds sway over the practice of medicine all around the world. It's no different in Europe. It's no different in India. It's no different in Australia. I mean, honestly, what we need is some sheikh from Dubai to give us $1 billion to set up a real, legitimate, holistic cancer research foundation, and then we'll have this question answered in 5 years. But right now, all we have, man, is anecdotal evidence from spurious people all around the world, and who knows? I don't know. All I can tell you is selenium supplementation reduces the occurrence of prostate cancer by 64%, and that's a remarkable degree. So if I had prostate cancer, one of the things I would do to support my body's ability to bounce back would be to take selenium, right? So I don't know whether or not he's too far gone. Remember, we can't treat this legally, but we can give the body support, keep our fingers crossed, and see what happens. And so the recommendation there, of course, would be the Healthy Body Start Pack 2.0 liquid. One of those. 2-bud, give him 2 bottles of plant-derived minerals. 2 selenium per 100 pounds of body weight per month. And as much Z Radical as he can afford.
Okay, thank you very much, Doc.
All right, I appreciate you. Thanks for the call, man.
Right.
You're the greatest. I appreciate it very, very much. Terry from Virginia is up next, but we don't have enough time to talk to Terry from Virginia. So we're going to bring Terry up at the beginning of the next segment. And ladies and gentlemen, if you like what you're listening to and you're listening on terrestrial radio, then listen during the commercial breaks for the phone number that your radio station gives out. Call that number for information about the health products we're talking about here, or about the business opportunity that the Youngevity Company brings to the table. If you're watching us on YouTube, if you found us all by your lonesome and you want information, you can either go to drglidden.com, get information there, or give my team a call. The number to dial is 855-347-3696. That's 855-347-3696. And if you were invited to this radio program by a pre-existing Youngevity representative, get with them to find out information about how you can proceed to interface with the company led by the physician who literally wrote the book on medical nutrition, who has sued the Food and Drug Administration on your behalf, and quite frankly, who is the world's leading expert on pathophysiology and its relationship to environmental stress and medical nutrition, Dr. Joel Wallach. Does not get any better than that. Stick around. Let's go to Terry in Virginia, jawbone infection. Hey, Terry, what's up?
Hey, Dr. Glidden.
Hey, Terry, what's going on down there in Virginia?
Hey, how you doing, Dr. Glidden?
Well, I'm
doing
good,
right?
but I think I'm going to get better. What do you think?
All right, then.
All right, I think I might.
Yeah, I'm calling today about my brother Adam, who lives here with me.
Mm-hmm.
He's 5'8". He weighs 140 pounds. He needs to pick up some weight, but he can't always, get the proteins and fats, and so he's fluctuating between the good and bad foods. He recently went to the dentist. He'd been having a really bad toothache, and had already taken about a half of a bottle of the extra strength Tylenols. And so he went to the dentist, and they x-rayed his teeth. And here's what they said. They said that he has rampant decay with advanced periodontal disease. Numerous teeth were fractured or non-restorable, abscess present. Clinically, most, if not all, teeth deemed non-restorable due to decay, periapical lesions, periodontal disease, and complete lack of oral hygiene. Recommend full mouth extractions due to the above conditions. Concern of infection spreading through the bloodstream, causing further medical complications. They said he had an infection in his jawbone, and they put him on amoxicillin, 500 milligrams 3 times a day, and he will be finishing his last capsule this evening, and we need to know what you think about it.
Well, you know, when all you have is a hammer, everything looks like a nail, and the dentists, the MDs, having no experience with medical nutrition, you know, they see a problem, they can't see any resolution for it, and so their thing is just rip everything out. Just rip it out. Rip the teeth out, rip the appendix out, rip the tonsils out, rip the adenoids out, rip the breasts off, rip the appendix out, rip the uterus out, rip the ovaries out, rip the knees out, rip the hips out. What the hell? You don't need those. So my recommendation is, right, when it's a non-life-threatening condition, use surgery as a last resort only, and give medical nutrition a chance. It's either going to help him or it's not. But even if it fails, his body, after 90 days of medical nutrition, is going to be in a much better space to handle a surgery like that, because that's a gigantic stress to the body. That's a big, bad voodoo daddy. And, you know, you wouldn't go into snowy weather in a bathing suit. Well, you don't want to go under the surgeon's scalpel in an undernutrified body. And if his body has this much periodontal disease, it's undernutrified. So the recommendation for him is, right, eliminate the 10 bad foods. He needs to get a bottle of the plant minerals. He needs to mix 1 ounce of the plant minerals with 1 ounce of either the Cal Toddy or the OsteoFX. The OsteoFX would be better for him, the Beyond OsteoFX. 1 ounce of the plant-derived minerals, not the Cherry Mints, the plant-derived minerals, 1 ounce of the Beyond OsteoFX. Mix them together. Have him hold it in his mouth, swish it around in his mouth for 2 minutes. 2 minutes, 120 seconds, 2 minutes, and then swallow it. Have him do that 3 times a day. And then I want him to rinse with 1 bottle or 1 ounce of plant-derived minerals in 1 ounce of water. 1 ounce of plant-derived minerals in 1 ounce of water. That's what I want him to rinse the teeth with after he's done the first prescription. Then I want him to rinse his mouth with 1 tablespoon in 1 ounce of water of colloidal silver. 1 tablespoon in 1 ounce of water, 1 tablespoon of colloidal silver in 1 ounce of water. I want him to put that in his mouth, swish it around in his mouth for 2 minutes, and then swallow that. And that's what I want him to do. I want him to do the calcium in the plant minerals in the water, the colloidal silver in the water, in that order 3 times a day. In addition to that, the Beyond Tangy Tangerine, the selenium, and the essential fatty acids appropriate for body weight. And last but not least, give him 1 bottle of Killer Biotic. Well, give him 2 Killer Biotic capsules 3 times a day with food. 2 Killer Biotic capsules 3 times a day with food. And if he doesn't stop eating the 10 bad foods, have him start shopping for dentures today, because he's going to need them. He needs to clean up his diet. He needs to give his body. This is like, you know, giving somebody the paddles who has a heart attack. This is an emergency intervention. There's no slacking. There's no putting this off. There's no cutting the therapy in half. He has to go for it. He has to go for it hard. You know, damn the torpedoes. Full steam ahead. Keep his fingers crossed and have him call me back in 4 weeks with a report. Demetrius from Georgia is up when we come back. Stick around, folks. Mission Impossible? Seems like it sometimes, because, you know, people are so enrolled in their own madness. The saying goes that we rattle our chains to celebrate our freedom, right? Oh, yeah, let's pass the Patriot Act without even looking at it. No problem. We rattle our chains to celebrate our freedom. We rattle our prescription medications and our monthly insurance payments to celebrate our health. We need our heads examined. Well, not members of Longevity Nation. members of Longevity Nation have popped out of the medical matrix. They've taken a hard look around. They've seen the unbelievable depravity which is levied upon humanity by reductionistic medicine. And they're standing up and speaking out about it. Politely, kindly, in a non-militant way, right? Look, I know a doctor that says you don't have to suffer with that. If I send you a link to this radio show, will you listen? If I send you a link to one of his webinars, will you watch it? If I lend you this DVD, how about it? We've got a whole bunch of DVDs in the back office. Got a whole bunch of DVDs. Check out the titles here. Check it out. What do we have here? I don't know if the camera can pick this up. Well, I'll tell you what that it is. Maximizing absorption of supplements, healthy weight loss, a strong body without cancer, healthy blood sugar, healthy bone and joints, cholesterol myth busting, healthy heart and blood pressure. Now, do you know anybody in your life that would need to watch those? This is all that we do. I know a doctor that says you don't have to suffer with that. If I lend you a DVD, will you watch it? If I send you a link to a webinar, will you watch it? That's all that we do. And, then let people decide whether or not they want to take the plunge. Give a little sample, not a bad idea. Give a sample of Beyond Tangy Tangerine. Give a sample of Rebound FX. Give a sample of CM Cream. Give a sample. Give a sample of the Pollen Burst, right? Whatever it is, people are going to respond because they're going to like how they feel, and the information is going to make sense because we speak about truth, and truth rings true. You can tell when somebody's lying. You ever notice that? You can tell when somebody's selling you a sack of crap. It's especially apparent during political elections, right? Because it is the rare politician who tells the truth. And you can just tell that they're lying. I mean, you can tell. And you can tell when people are giving you a crock of crap and when people are straight shooters. So all that we need to do in the Longevity Nation to be successful is tell the truth and point. Speak as little as possible. Listen as much as possible. Tell the truth and point. And then it gets very, very interesting. Let's go to Georgia and talk to Demetrius. Hey, Demetrius, thanks for the call. You are live.
Hey, Dr. Glidden, how you doing?
Pretty good, man. What's up?
Well, I was calling because I had a couple of questions for you. One is pertaining to my grandmother. She's actually going through dementia right now, and she's also a diabetic. And I was wondering what you would recommend for her. And also, is there any validity to drinking high pH alkaline water when it comes to helping your body when it comes to...
Well, the whole pH thing is misunderstood. And the body, the idea here is that when the blood becomes acidic and when the cellular environment becomes acidified, it's not good. And that much is correct, that it's not good. But the body has buffering systems in place that it can use to leverage to stop this from happening. And the body really doesn't want its tissues to become too acidic, because if that happens, you go into a coma. It doesn't want the body's tissues to become too alkaline either, because you get real funky if your body is too alkaline. So the buffering systems of the body attempt to maintain tight control over this. The buffering systems burn right through your minerals, however. So one of the best ways to ensure proper pH of bodily tissues is by upregulating, or by giving your body enough of the essential minerals that it needs. So if somebody is taking Longevity's mineral supplements, they don't need to worry about upregulating or making their body more alkaline, because the pH system is supported and the body's taking care of it. Now, you can make the argument that alkaline water is more easily absorbed by the body, and that's true. And so I think most people in the world are dehydrated. I think most people would benefit from drinking more water, whether that necessitates the expense of the Kangen water machine. I don't know, $4,000. I don't know if it's worth it, quite frankly. So that's what I have to say about that. And if you do have an alkalizing water machine, just make sure you're not drinking alkalinized water with a meal. because that will neutralize your stomach acid and interfere with digestion. So that's a bad idea. Drink it between meals, not with a meal, right?
Right.
So,
is there any, I was just going to ask real quick, is there any negativity with taking alkaline water with like tangy tangerine?
No, not at all. It will probably increase its absorption, quite frankly. You probably increase its absorption.
Awesome. Okay.
Yeah. So, and alkaline water is more easily absorbable by the body, and most people are dehydrated. But I just don't know. It all depends on where you're getting it and how much it costs, and there's a cost-benefit ratio to everything, right?
Sure.
Right. So now for dementia support, the first thing that we do, in addition to the 90 essential nutrients, is more essential fatty acids and more B vitamins, B like baby. Okay. The longevity supplement that carries the lion's share of B vitamins is D-Stress. It's called D-Stress, like detoxify D-Stress. So the recommendation, 1 bottle of D-Stress per 100 pounds of body weight per month, 1 extra bottle of EFA Plus or multi-EFAs, on top of the Healthy Body Start Pack 2.0 liquid, selenium, and plant-derived minerals appropriate for body weight, plus a diet high in cholesterol and zero tolerance for the 10 bad foods. Now, I was just at a naturopathic conference a couple of months ago, and interesting research is showing that bisphenols, which are found in the water of bottles that are in, plastic, everybody's plastic water bottle. You go to the grocery store and buy 24 bottles of plastic water, right?
Right.
Well, there's a chemical that leaches out of the plastic called bisphenol, and when bisphenols go into the blood, they do the same thing to the blood-brain barrier that gluten does to the gut.
Wow.
It interferes with the tissues in the blood-brain barrier, making the blood-brain barrier more leaky. And listen, the blood-brain barrier isn't what medical doctors think it is. I learned this from Dr. Wallach, but it is a structure, and it does have some type of protective mechanism. But the bisphenols in water from plastic bottles mess with that. So the recommendation is, and this is hot off the press, by the way, and I don't make recommendations that aren't supported by really, really good clinical science, not just a couple of research papers, but, there has to be really good, legitimate science here that I have to pour through and see that there's not any bias in it, and that's not easy to do. So my recommendation is just stay away from water that's been in plastic bottles because it's loaded with bisphenols, and it's going to mess you up over time.
It's funny you said that because my grandmother, they have said that she has excess fluid. They had to actually do a spinal tap to release it, and she started, her memory is just, everything started to come back just a little bit. Like, she seemed a little more normal when they did that. And they were saying that obviously it was doctors, but they said that, she was, she had excess fluid, around her brain.
Yeah, so that's a circulatory problem. When fluid accumulates anywhere in the body, it's because the circulation is messed up. And remember, it's the circulation's job to bring stuff to the tissue and then to take stuff away from it. And just like the drain in your sink, if that gets clogged, well, the sink's going to fill up with water. Well, when, your circulatory system gets messed up, then fluid's going to build up anywhere. And in this case, it builds up in the central nervous system. That's not good. So given that amount of information, I would switch the D-Stress to the Ultimate Daily Capsules. I would switch from the D-Stress to the Ultimate Daily Capsules and make sure she gets 100,000 ORAC of antioxidants a day. The easiest way to do that with elderly people is triple treat chocolate, right? Give her 4 or 5 pieces of triple treat chocolate a day. And what they say, man, that beats a poke in the eye with a sharp stick. Thanks, Demetrius. I appreciate you very much. Frankie is here from Texas. Hey, Frankie, do you have spurs that jingle, jangle, jingle?
I just had a question about, I listened to a CD saying that cataracts can be reversed, and I had gone to a doctor, and they were said my cataracts cataracts were pretty bad, and they're wanting to do cataract surgery. But he said, I may see better, but I may see worse because of the condition that I have in addition to that called Fuchs syndrome. So I was wondering what you have that, I mean, I really don't want to have surgery. And so is there anything that can reverse the cataract?
Well, I've heard about things that reverse cataracts. I've never seen it in clinical experience. I've had people come up to me and tell me that they used to have cataracts and they don't anymore, and I have no reason to believe that they were lying to me. Okay. So, anecdotally, I've read about it and I've heard about it secondhand. I've never seen it clinically. I think I've maybe only treated cataracts maybe 3-4 times in 25 years, if you can believe it.
Wow.
So I'll tell you what we believe the mechanism is, and this is worthwhile thinking about and thinking through because, you know, the cataract itself is not the disease. It is the result of the disease. It's the lens of your eye has become cloudy. The lens of the eye has become damaged. We believe it's free radical oxidative stress that's damaging the lens of the eye. Now, you know, you don't get cataracts because you have a lens. You don't get cataracts because you have an eye. If that was the case, then everybody who has eyes would have cataracts, and that's not how it goes.
Okay.
So even if they do surgery, right, that's not going to fix the process that caused the lens to get funky in the first place. Okay. That process is still going to be at play in the body, and it's only a matter of time until something else somewhere else breaks. It's kind of like painting over the mold in your basement with paint, right?
Okay.
I mean, even if it's Glidden paint, it's not a good idea because you're just painting over the problem and you're not really fixing it. So surgery, even if the lenses are too far gone, well, you know, surgery is going to help you to see better. Maybe not perfectly, but it'll help you to see better than it would with a cataract. But it's still not going to fix the problem that caused the cataract to form in the first place.
Right.
So we need to get on board with a program that will do that.
Okay.
And then, you know, give a little extra lens support, keep your fingers crossed and see what happens, because this is a non-life-threatening surgical procedure. You're not going to die if you don't have it, so we might as well give it the old college try, right? I mean, that just makes sense. You stick around with me, Frankie. I'll pull you up immediately after the hard break. I appreciate your patience, and more importantly, I appreciate your trust. I'm Dr. Peter Glidden, ladies and gentlemen. Stick around. Again, ladies and gentlemen, spent 2 hours with yours truly. Every day we learn a little bit more. I know that I do. I hope that you do as well. Remember, knowledge is power. Your doctor does not know what's best for you. They only know what they've been trained in, and what they've been trained in is just one small piece of the pie of medical science. There's a much more to know about medicine, and we bring that knowledge to the table every day of the week from 3 to 5 p.m. Central Time. I appreciate your indulgence. Let's finish it out with Frankie. Frankie, you still with me?
Yes, sir.
All right. So the recommendation here is that this is a comprehensive, holistic approach, right, which is what makes us so interesting and so unique. Because we just, you know, we kind of clear the deck, eliminate food that's hurting the body, and then give the body everything it needs in absorbable doses and, you know, damn the torpedoes type of a deal, okay? So the recommendation is eliminate all 10 bad foods. Now, that includes oil in a bottle and fried food.
Okay.
So our belief is that, you know, this problem with the lens is caused by an overabundance, a superabundance in your body of something called free radicals. You know, and free radicals are everywhere all the time, but there are certain foods that are high in free radicals, and it would be a smart idea to stop eating them because we get enough free radicals just from walking down the street and breathing in automobile exhaust. So eliminate the 10 bad foods, please, number one. How much do you weigh, Frankie?
About 130.
All right. So you would need 3 bottles a month of Ultimate Selenium, because your body has a fire department which puts out the fires of inflammation, the same way that it has a police department, which is your immune system. And selenium is the captain of the fire department of your body. Selenium is essential in your body being able to put out the fires of inflammation, which are just a normal part of life.
Is that liquid or capsules?
Capsules. It would be Ultimate Selenium. You would need 3 of those, 3 bottles a month, and that's 9 a day. The recommendation there would be 3 capsules 3 times a day between meals. It's best to take that between meals. If it makes your stomach feel a little funky, then have a little bit of yogurt or a banana or some fruit. Okay. But it shouldn't. The capsules are small. They go down easy, and there should be no harm and no foul.
Okay.
All right. Now, the next thing for you to do is figure out a way to get antioxidants into your body in large numbers. Now, antioxidants are measured by their ORAC score. That's ORAC. Mm-hmm. Generally speaking, for general health, the recommendation is between 20,000 and 50,000 ORAC a day. In your case, because the game is afoot here and there's oxidative damage rampantly in your body, the recommendation would be for you to secure 100,000 ORAC points of antioxidants a day. Now, different foods have different amounts of antioxidants, and you're going to have to figure this out. You can go to my Facebook page, the Dr. Glidden Facebook page, and you can go to Wellness Warriors on Facebook, and you can interface with the community there and try to figure out how to get more ORAC into your body. Youngevity has a couple of supplements that are loaded with ORAC. The easiest and I think best tasting is a chocolate. It's called Triple Treat Chocolate, and 1 piece of chocolate has 19,000 ORAC points, and that beats a poke in the eye with a sharp stick. So 5 pieces of chocolate a day, you're good to go. So that's one option. Food, beverages, green tea, red wine, things like that, or cinnamon curry powder. But you'll be able to figure it out. You sound like a smart woman. Now, in addition to the increased antioxidants and the selenium, we need to round this out. And we do that by giving your body all 90 essential nutrients in a dose appropriate for your body weight. The best way to get that is with 1 Healthy Body Start Pack 2.0 liquid. It's a ponderously long name. It's called the Healthy Body Start Pack 2.0 liquid. You need 1 of those a month. And 2 bottles, please, of plant-derived minerals. 2 bottles of plant-derived minerals. You should be good to go with that program. That's what I would do. There's also a homeopathic eye drop that I've heard anecdotally is helpful here. It's called Cineraria maritima. Cinnereria maritima. You'll have to Google that. Youngevity doesn't make it. Cineraria maritima eye drops may also be helpful. I would pursue this therapeutic for 90 days in a row. Keep your fingers crossed and see what happens, and call us back with a track record. I'd look forward to that. Next live event tonight, ladies and gentlemen, 8 p.m. Central Time, live chat for Dr. Glidden Insiders. See you then.